Working in a CBHC setting, there are a ton of unique benefits. You are a part of a new innovative way that the state is trying to get people services.
CBHC stands for Community Behavioral Health Center, and it's really a one-stop shop for our individuals' needs. In one place, they can receive all their services.
We have not only clinicians and psychiatrists, but we have care coordinators and case managers and nurses. We really are a one-stop shop. People come with all sorts of needs. Many people come initially with mental health needs, but then we discover that they have housing needs or economic needs. We have a pharmacy here as well, so people can even get their medications filled right here.
We're trying to keep people out of the emergency rooms, which is always a huge plus, and we're also just trying to get them the help that they need as quickly as possible.
It is meant to meet the whole person, meet them where they're at, instead of just straight up outpatient therapy. It's not just one-on-one therapy. We can treat the whole individual.
When people come into the clinic seeking services, it is walk-in. So they come in, they meet with our admin, we provide them the paperwork and get them a chart ready.
The people that I support really benefit from the CBHC because a lot of times they don't know what they have access to and they need help in navigating that. And so when they come in and they speak to one of us, they're getting a better idea of what our services are, what they look like, what we offer, and what they're able to access.
We serve all age groups. I had a 5-year-old come in the other day, and then I had an 82-year-old come in the other day.
So CCS is Community Crisis Stabilization. I usually think about it in two ways. So one is that it is a step-down program from people who are in the hospital and they're kind of transitioning back into their homes in the apartment. The other aspect is if they don't quite meet hospital level of care, but they still need more support, then sometimes we direct them to CCS just so that they can have that support and avoid a hospitalization hopefully down the road.
The individuals I support very much do inspire me to come back to work day after day because they are so resilient.
A lot of them have been through so much in their lives, and many of them, they come in, they're grateful for the help, they are kind, they're happy, and they just continue to come in looking for help and continuing to look for ways to get better. The culture at Advocates is great. It definitely has a unique culture. The mission statement is real, it's very live and well here.
It's warm and welcoming, caring and compassionate. One of the reasons I've been here for 16 years is exactly that culture.
As you come on board and you're new here, we want to encourage you to kind of be part of the community, ask questions, get to know your coworkers. It's so much more than a job. It's not just a job. I do this because I want to help people, and I love what I do. At the end of the day, I know that I'm making a difference in people's lives. I like seeing people progress in their goals. I love working with my teammates here. I think it's just a really rewarding and successful career to be in.